China has ordered the U.S. to shut its consulate in the city of Chengdu. It's a tit-for-tat measure, as earlier Washington ordered Beijing to shut up shop in Houston. China says it's not looking for a fight, though.
The current situation in bilateral relations, which the US is entirely to blame for, is not what China desires to see. Once again, we urge the US immediately to retract its wrong decision and create the necessary conditions for bringing relations between the two countries back on track. Some of the personnel in the US consulate in Chengdu engaged in activities inconsistent with their capacities and interfered in China's internal affairs. They harmed China's national security interests. China has repeatedly made representations to the former consulate, and America is aware of this.
The Trump administration ordered China to shut its Houston consulate on Tuesday. Mike Pompeo defended the move, claiming that Beijing was stealing intellectual property. Beijing called the abrupt closure of its consulate a political provocation, while its foreign ministry said the country's embassy in the U.S. received death threats because of anti-China sentiment whipped up by Donald Trump. As tensions escalate between the two geopolitical foes, the U.S. Secretary of State has called on other nations to form an alliance against China.
Look, we have to admit a hard truth. We must admit a hard truth that should guide.
Fox News alert now on a newly declassified FBI document about its Russia investigation. The document shows President Trump's first intelligence briefing as a candidate back in August of 2016 was led by agents who had already opened an investigation into his team's ties to Russia. A summary of that briefing would later be filed as part of the so-called Crossfire Hurricane investigation. K.T. McFarland is a former Deputy National Security Advisor to President Trump and author of the new book, Revolution, Trump, Washington, and We the People. KT, good to see you. Let me just pull up a little bit of this memo from Joe Pientka that was written on August the 30th of 2016. The actual briefing happened on the 17th. He says, quote, during the ODNI, Office of Director of National Intelligence briefs, Reiter actively listened for topics or questions regarding the Russian Federation. During a discussion regarding nuclear testing, Russia and China were brought up as cheating on the nuclear test ban treaty. Trump asked, who's worse? Redacted stated they are both bad, but Russia is worse. Trump and Christie turned toward each other, and Christie commented, I'm shocked. It was President Trump, Governor Chris Christie, Michael Flynn, all in that meeting, which now appears to have been a fishing expedition and not an intelligence briefing.
You know, this is just simply extraordinary. A defensive briefing. I set up a number of defensive briefings for the National Security Council and White House staff in the beginning of the Trump administration. A defensive briefing is to tell people, particularly people who are not used to handling classified information, this is how you handle it. This is how you dispose of it. You don't leave it on your desk. You don't take it home from work. But the other thing a defensive briefing does is to tell you how to look out for spies. And one of the points that we made was, look, you're new to this. People are going to try to recruit you. They want to find out what you know.
Up until recent weeks, President Trump has repeatedly pushed some scientists' claims that the coronavirus would disappear once temperatures increase in the spring. Now, in the dog days of summer, and with more than 1,000 daily COVID-19 related deaths consecutively over the last 3 days, that theory is being called into question. According to the COVID tracking project, it took just 15 days for the country to go from 3 million confirmed cases to 4 million. By comparison, the increase from 1 million cases to 2 million spanned 44 days, and the leap to 3 million took 27 days. In total, more than 144,000 American lives have been lost. For more on the latest developments, let's bring in Dr. Bob Lahita. He is joining us from New Jersey. Dr. Bob, yesterday, Dr. Fauci, Anthony Fauci, suggested life could return to normal by sometime next year with the development and implementation of a COVID-19 vaccine. At the same time, the CDC released a preliminary plan on who should get it first. Would the whole of America really be able to, quote, get back to normal based on the agency's distribution list?
I don't think they're going to get back to normal right away. I think that it's logical, and we've been talking about this for many months. It's logical that healthcare workers, emergency medical technicians, paramedics will be first in line, and that will be followed by people with underlying conditions like chronic obstructive pulmonary disease, congestive heart failure, a variety of other conditions that are of unto themselves life-threatening and which would have a devastating effect on a person if they were to get COVID-19. And then we have the issue of the socioeconomic groups and the ethnic groups. African Americans, Latinos tend to suffer more with this disease and die more with this disease. So should they be included in the early stages? The elderly certainly should be. Those who are in nursing homes, large crowded nursing homes, they should be included in this. And then we have other issues about, it goes on, teachers, bus drivers, subway conductors, train conductors, and so on and so forth. So you can see that as this vaccine is available and to bring America back to normalcy, we need to prioritize who should be getting the vaccine early on.
So we have been hearing that there could be sort of more than one version of COVID, and now we see that researchers in London have identified 6 different versions of COVID-19, some of it based on the symptoms. What can you tell us about this research and why it's significant?
Well, I think, Anne-Marie, you've gotten into it, and this is the first I've heard of this research, actually, but I think it's very, very interesting because, among the patients I see, those who have recovered, many of them present in different ways. Some people with fever, some people without fever, some people with nausea and vomiting, some people with diarrhea, etc. So there are basically, according to this British study, 6 types of COVID symptom presentations. And that includes, of course, the usual cough, fever, and decreased sense of taste and smell. But then you've got headaches, you've got muscle pains,